Hello, everyone. We'd like to thank you for having interest in either kinesiology or athletic training, sports medicine. My name is Scott Landis, and I'm a faculty member in the athletic training program within the College of Education, and I'll tell you about that program shortly.
Hello, everyone. My name is Daryl Craig. I'm an academic coordinator in the kinesiology program here at WSU. So I am going to describe information about the kinesiology program, and then Scott will take over and discuss the athletic training program. So the kinesiology program here at WSU offers learning through a combination of world-class research labs. We have 4 research labs that I will describe later. And then great innovative teaching by our faculty. There's lots of opportunities for hands-on experiences in our research labs, but also within our curriculum through multiple courses that have required hands-on experiences in multiple different settings within kinesiology. So the applied experiences, when our students graduate, they will have over 500 hours of practical and internship experiences. The final course that our students take is a 10 to 12 credit semester-long internship in which they are applying knowledge from their theoretical classes to a real-world situation. Students can complete their internship either in the fall, spring, or summer, and it is the final course that they take. And for many of our students, this internship experience is completed outside of Pullman. So they complete their coursework in Pullman, their in-classroom coursework, and then their final experience can be completed in Pullman. We do have some students that complete it here in Pullman, but also across the country and around the world. We have had some students complete their internship experiences abroad. There's lots of opportunities for our students to learn outside of the classroom as well. So we have a very active kinesiology club. We also have faculty members who conduct research and involve and incorporate undergraduate students into their research labs. So this is a relatively unique experience for a Research One institution such as WSU, where our faculty members are incorporating multiple undergraduate students into their labs and provide them the opportunity to learn about research and potentially present at regional and national conferences. And we've also have some students who publish articles with our research faculty, so peer-reviewed journals, and they're able to publish those before they finish their undergraduate degree here at WSU. So the first lab I'll describe is Exercise Physiology and Performance Lab. We've highlighted some of the recent research agendas and projects within this lab. Our students have lots of experience presenting at a regional ACSM, so American College of Sports Medicine conference. Faculty member who coordinates this lab is very active in that organization, both regionally and nationally, and usually will take multiple students to present their research at that regional conference. The biomechanics lab, led by Dr. Katina, here are some of the studies that he's currently conducting. Again, multiple students have been involved in this research lab. Many have published with Dr. Katina, and a few of them have presented at the National Research Conference for Biomechanics. Psychology of Physical Activity Lab, the 4 items there are current research that's being conducted by our 2 faculty members who coordinate this lab. Again, they've had students present at regional and national conferences, and some have been published in manuscripts in peer-reviewed journals. Our 4th lab is a cognitive motor neuroscience lab led by Dr. Prashad. These are 3 of her current studies that she is conducting. This is a relatively new lab for our program. There are undergraduate students involved in the research, and she will eventually take them to regional and national conferences. post-pandemic. So that's another great opportunity for our students. For each of the 4 labs, for students to become involved in them, they just need to reach out to the faculty member who coordinates the lab. And usually there's an interview conducted where the students get to learn more about how undergraduate students are involved in the research within that lab, and to determine if it's a right fit for them. The Kinesiology Club is a very active organization on campus, and it offers our students some great opportunities to connect with peers, learn more about careers within kinesiology via multiple guest speakers, including alumni and professionals in Pullman and around the state of Washington. And there's opportunities to enhance communication skills, organizational skills, and collaborating with faculty. Our faculty are very involved with some aspects of the club as well. So it's an opportunity for students to, again, learn outside of the classroom and connect and enhance their knowledge within the field of kinesiology. The Kinesiology Club also hosts an undergraduate research conference each semester. All students within kinesiology and athletic training are required to present in 2 separate classes within their curriculum. So they analyze some research from peer-reviewed journal articles throughout the course of the semester, and then present this at the conclusion of the semester. They are judged by their peers as well as professionals within the community. So it's a great opportunity for students within kinesiology and athletic training to gain knowledge of research and also enhance their presentation skills that will certainly help in their future as a professional. So application information for our program. So we admit roughly 140 students per year. We have 2 application cycles, one in the fall and one in the spring. Students must complete 2 of our courses, Human Motor Development, which is Kinesiology 199, and Anatomy, which is Kinesiology 262, earn a minimum of a C or better in those classes, earn a minimum of a 2.75 WSU GPA. So that's important for students that transfer. It is just their WSU GPA, and they have to complete at least 24 credits. So this is 24 credits overall. It's not necessarily 24 credits at WSU, it's just 24 credits total. So for those transfer students or running start students that have credit coming in, that's important to understand as well. And with those 140 applications, it's roughly half in the fall and half in the spring, although it's not exactly 70 and 70. It just depends on the applicant pool in any given semester in September or February. I've included on the screen here some careers that our students have pursued post-graduation. So I'll just leave this up for a minute so you can review it and look it over. There are multiple examples of students on this list who completed their internship experience or Kinesiology 485 in the setting that you see here, and they were offered a job immediately after they finished their internship. Additionally, many of our students pursue graduate or professional degrees after they graduate from our program. So here's some examples of particular programs and schools where our students are matriculated post WSU graduation. So it's very diverse in terms of the health care settings that are and healthcare programs that our students pursue, as well as diverse in the geographic locations where our students matriculate. We offer a minor in strength and conditioning, which allows our students who are looking for very good practical hands-on experiences to achieve those at WSU. We are one of the very few schools in the country that is certified through the National Strength and Conditioning Association, or recognized through the National Strength and Conditioning Association for our curriculum. Students with the minor gain experiences in the WSU athletic department over the course of multiple semesters. And it's a very intense experience where they learn from the certified strength and conditioning specialists in the WSU athletic department regarding programming, implementation of workouts, in addition to some theory within the classroom. Our students in the minor, many of them are pursuing the CSCS certification upon graduation, and they pursue a lot of different career paths. So some are interested in becoming a strength and conditioning coach at the collegiate level or professional level. We also have students that are looking at enhancing their applications to professional programs through the knowledge and experience they gain through the minor. So that's a lot of different pre-professional programs, including PT, OT, physician assistant, medical school, and so forth. So this is a very unique opportunity within our program, and we're very, very proud of it. And the experiences that our students gain are very valuable. As you are making your way through, your final years of high school or community college, we wanted to remind you of the importance of coursework that is related with kinesiology that you may be able to complete during your last year or two of high school or community college. So our students who are successful in our program have a background in biology, chemistry, physics. They're able to take some coursework in high school as well, potentially college algebra and trig, because those will certainly help contribute to their knowledge within particular classes. And WSU also requires a minimum score on our math placement exam, which is called the ALEX, or completing a math course or two at a community college that would serve as a prerequisite for multiple classes within our major. This is the same for athletic training as well. Students within both programs will take a biology course, chemistry course, a physics course, anatomy, physiology, and there's a couple of other kinesiology classes for which the math background is very important in serving as a prerequisite. Okay, so I will turn it over to Scott now, and he will provide some information on athletic training.
All right, so again, my name is Scott Landis, and I'm one of 3 faculty members in athletic training. I work very closely alongside 2 other colleagues of mine, also faculty members who teach in our program. Katie Peets is the clinical education coordinator here. She serves as the advisor role for students interested in our program once you actually are on campus. Once you're a WSU student, she will be your advisor. I work directly with pre-WSU students, so it's any individuals who are currently in high school or a transfer student interested in coming over to our program or our school. I will be your contact to help you make that transition. And then Dr. Casey Hildenbrand, who is our program director, serves as the advisor for admitted students into our major, that is sports medicine and athletic training. And I'll go ahead and dive into what that looks like next. So I find it important to make sure anybody interested in our program knows a little bit more about what athletic training is. And if you've heard of athletic trainers, we don't by definition train athletes. We are a healthcare profession, and we work with patients, generally an active population, to prevent, diagnose, intervene in an emergent setting, treat all injuries, chronic and acute, any impairment, any functional limitation or disability that an individual has, we will treat within our scope of practice. And that turns into rehabilitative, again, emergent care, and preventative medicine as well. So the population that we generally will serve as an athletic trainer can be anybody active, doesn't matter what level they are, professional, Olympic, even at the junior level, secondary school level. And although any body part can be injured in any number of different ways, it generally is musculoskeletal in nature. So we really specialize in that. But there are, again, those prevention components can filter a little bit over into more of a strength-based, fitness, performance-based consideration. And So yeah, and then technically, we always have a medical director over us, no matter what level we work at, and that physician may say, we need to work with this population. Maybe they're less active, or maybe they're more of like a geriatric population, similar. So of those populations, where do we see those populations? Traditionally, and this is what a lot of prospective students to come to WSU have experienced, an athletic training facility or clinic, whether it be at the high school you go to, or maybe there was an athletic trainer at the physical therapy clinic. You were getting rehabilitation done for your surgery you had or injury you had. There's a number of different settings. Others that are a little bit less common would be, something as elite as the Olympic sports venues, hospital, inpatient and outpatient. You can work more of like a gen med rotation with physicians directly. Also community facilities, and even like commercial, industrial settings and governmental settings. So Boeing has hired our athletic training students who graduate. We've got Tesla, even performing arts venues such as Cirque du Soleil. We have somewhat of a recent graduate who actually works in Las Vegas and works one of the specific Cirque du Soleil shows. And I mean, every night, she's working to make sure that if the performers are injured, she's there to help them out. So I always find it meaningful and helpful for us to discuss a little bit of the difference between physical therapy and athletic training. There is absolutely crossover, especially when we talk about the rehabilitation component. So just some differences, as you can see on the slide here. Population-wise, generally, athletic training is a little more physically active, where physical therapy, there's no limits. You could be very active individuals, such as a competitive collegiate player, or it could be, a 60-year-old or 70-year-old patient who had a knee replacement, where the recovery is going to take a significant more amount of time than it would a physically active individual. Athletic trainers are there when the injury occurs. That's a real big difference between physical therapy and athletic training most of the time. So we get an opportunity as an athletic trainer to really treat and manage that injury from the start of it. One other difference is the level of education. So we do require a master's degree now. There was a very recent transition for athletic training to go from undergraduate mandatory to graduate master's level mandatory. For physical therapy, there is a required doctorate level, a DPT degree. And so as my colleague Daryl would agree, kinesiology would generally be a smooth transition if you find that you're interested more in the physical therapy component, because their setup and their course not expectations, but plan really sets you up to allow you to take all of the required courses that you might not have as much time in as an athletic training, interested in athletic training to take our program. So that's a pretty big differentiating one right there. Now with that, if you are interested specifically in the WSU program, we have our undergraduate and graduate degrees mixed. They're a hybrid. And so it's technically, if you're a traditional student, a 5-year program to get a undergraduate degree in sports medicine and a graduate degree in athletic training, master in athletic training degree. And next, athletic trainers generally, again, will see their patients and athletes every single day, 5 to 6 days a week, where sometimes insurance or medical, the physician in prescribing physical therapy might say you can only see your patient twice a week or 3 times a week. And lastly, we have a little bit more of a broad spectrum of what falls within our domains of practice. We like to really emphasize prevention, immediate treatment, and rehabilitation, whereas physical therapists, they truly own rehabilitation to cover any potential ailment, disability, injury that needs to be rehabilitated. So if you're still interested primarily in athletic training, what does it take to become an athletic trainer? You need to now we're finished with bachelor's, but we're just finishing out the last nationally, the last grouping of bachelor's earners, you need to earn a bachelor's degree from an accredited program. The accreditation company is the CATE, CAATE. CATE is our accrediting body for education programs, and they dictate nationally what programs are acceptable as an athletic training program to graduate from. Once you've completed one of those, such as ours at WSU, you would sit for a national certification exam, which is through the NATA BOC, Board of Certification. And upon that, you get credentials as an ATC. So what does athletic training look like here at WSU? We are once admitted into the program, which should be important here. So traditional students would apply once you have earned 50 credit hours. Now those, and we only accept applicants in the fall every year. So that's 1 year, 1 semester application time period. And you can count your fall semester that you apply, but 50 credit hours. And once admitted, there's a subsequent spring semester where we do an introductory kind of we call you pre-first years, pre-athletic training program. Traditionally though, you would start in the fall of your junior year. And so from there, it's a 6-semester program, 3 remaining years. Junior year, senior year, you get your sports medicine undergraduate Bachelor of Science in Sports Medicine degree, and then 1 final year at that master's level. We get to cross over some of your 500 level master's classes in that second year where you're a senior, about to graduate before you start your master's program. And so once you arrive and you're getting all of your prerequisites done and classes that we need you to take, there's 2 that we really need to emphasize here. And the first is ATHT 267. That's an introductory athletic training course that's taught by my colleague, Katie. She does a really good job to make sure you fully understand that application process and sets you up for literally everything else you see there. The other is Kinesiology 262. That's our departmental human anatomy and physiology course. And we need you to get a C or better in those classes, both of those. On top of that, we need a 3.0 minimum cumulative GPA. This isn't something that we can unfortunately say, oh, the 2.95, you were so close, we'll let you in. It's a graduate program requirement. And so we just set that bar early and just say 3.0, you got to keep it. Yeah. We'll also want 3 letters of recommendation, and we'll have an interview process because we do only admit maximally 25 students per year, every fall, 1 time. We are seeing that this is a fairly competitive program. So, really working towards a high GPA, prep for the interview, do well in these 2 classes will set you up for a really good opportunity to be in our program. I believe I mentioned this already again, but we'll just kind of review it to make sure that I did. Again, a traditional student would be a 5-year program. And you get 2 degrees, Bachelor of Science in Sports Medicine and a Master's in Athletic Training. You apply the fall of your sophomore year, start officially and formally the fall of your junior year. Looking at what the clinical experience is like once you are an athletic training student here at WSU, we span just over 2,000 hours of clinical internship over a 6-semester span. Now, it's not even between all 6 of those semesters. We know that you're more academic based earlier on, especially as a junior. So we know you have a lot of classes. That way, we only put you in about 10 to 12 hours a week of clinical experience throughout your first year. But as you become a second year and then your final master's year, the number of classes goes down that you take. And so your clinical experience and those clinical hours starts to increase. Your first year in the program, we make sure you are exposed to every single sport at WSU, Division I varsity level sport. Your second semester, we assign you to an actual sport. Your second year is all off campus. So we'll put you at one of the sites you see below, a high school, and you rotate through all of these. Physical therapy clinic, you actually get to do a gen med rotation, and go work at the University of Idaho in their athletic program. And then your final third year, you are assigned to one sport. That is the sport you get to really own and kind of take charge in covering from all aspects of what an athletic trainer will do. Now, unfortunately, as you may already have expected or assumed, when we ask 2,000 hours of you, especially that third year when you're getting about approximately 30 hours a week, 30 to 35 hours a week of clinical experience, it's just not feasible to be an athletic training student and a Division I varsity level athlete. Intramurals is absolutely still an option. And technically, that fall of your freshman year, you wouldn't be admitted, you wouldn't be in our program yet. So, if you want to do a 1-year college athlete experience, no problem with that. But upon admission to our program, we cannot accept any varsity athletes. There's quite a bit of overlap between classes that we incorporate within athletic training and kinesiology programs. On the left, slightly more athletic training based, and then on the right, there's a good bit more overlap between kinesiology, which is natural for both of what our programs desire to give to our students. A few classes and topics that maybe you wouldn't actually see at all, even athletic training programs, would be our psychosocial considerations in sport, in athletic training. We really dive into the emotional and mental capacity, the component of athletic training in healthcare. And then lastly, the leadership and communication aspect as well. So what is our academic experience like for athletic training? We do have a classroom that is dedicated to just athletic training. We actually have treatment tables to serve as our student desks. So we talk about it, we learn it, we discuss it, and then we put our hands in and we do it, whether it be some type of rehabilitation consideration or a modality and whatnot. It's very kinesthetic and hands-on. We do have small class sizes. Again, maximum would be 25. And not even if we have, 25 students applying, it's a fit for both of us. And we want you to be a good student for us, but we want to be a good program for you as well. But having small class sizes really optimizes the student experience here. And we don't want 50 students all at one clinical site as well. So hopefully when you're getting clinical experience, you learn about an injury. Maybe we just talked about it in lower pathology class, and you get to bring it in and we talk about it, and never want anybody to suffer an injury, but sadly it's going to happen. So we want you to be there to see it and see how it's managed, so you can learn from it. If you're still, kind of pulling from different considerations on what you're thinking would be an interest to pursue as a career and a profession, these are a few just another components that kind of we find a lot with athletic trainers that like what they do. So most, not absolute either, by the way. So generally, athletic trainers, athletic training students have an interest in athletics and sports, right? They think the human body is very fascinating and they want to learn all about it. There is a service component to athletic training, whether people want to admit it or not. You do serve a patient care population, a lifelong learner, constantly learning things differently than how I learned in undergrad and how I learned in grad school. Medicine is not absolute. You can always improve it and learn better ways to do things. Very heavy on multitasking. No 2 days are the same within athletic training. You will never see the exact same injury with the same patient who's going to react the same way as the one before did. So we constantly are working through all of that adaptation. Yeah, there is different populations, different age groups, and it is not a traditional desk job. It will not be an 8 to 4, 9 to 5. There are, think of when you watch athletics on TV, that would be some of the hours that athletic trainers are going to work. Not completely. High school has far more rigid hours than perhaps a Division I collegiate level athletic trainer would be. So if you are interested in our program specifically, but you may reach out to me primarily. Katie is also available, but she would forward you to me anyways as a prospective student. And happy to answer. I know Daryl and I both would be happy to answer any questions you have about our programs. Thank you very much.